Thank you. Dr. Ross, thanks for going through the process on this. You've been very outspoken for years for the health of Americans and for Americans taking better care of themselves and for us finding out how to be able to do that better as a nation. So I appreciate the work that you've done on this. You and I have visited already on several of these issues, but I want to be able to probe a little bit farther. The pharmacy benefit manager issue has been one this committee has taken up in a bipartisan way. We spent a significant amount of time last year as a committee. We passed overwhelmingly a pharmacy benefit manager bill out of this committee. We tried to be able to get it actually to the floor. Senator Schumer didn't ever bring it to the floor last session, then tried to get crammed into a last-minute bill on the end of the floor and didn't fit. With all that, the problems still remain on this. Some of them CMS can take care of. Some of them this committee has to be able to take care of as well. As we've got to be able to finish that work that has been nonpartisan work here to be able to get done. 450 independent pharmacies closed last year, more than one a day. Most of those pharmacies, if you went and talked to them, they would say the breaking point was what pharmacy benefit managers are doing them. That is mostly rural health care, and the access to that pharmacist in those rural areas all over the country is lost. And people are going to have to mail it in because a PBM makes more money to be able to do that. That's a major problem. There has been a rule out there for CMS, the non-interference rule, that has created a challenge for CMS to be able to engage. What is it that you feel like you're going to need as far as authority to be able to engage on the issue of PBMs, and thoughts that you may have on that?
Senator Lankford, you had remarkable and deep insights into PBMs, and I appreciate taking time to learn about them because although they do provide an important service, taking the medications from the pharmaceutical company that's created the product and putting it into the pharmacy system, or as you point out, mailing it directly to patients, they also create a pricing spread. And that's where some of the problems occur. The lack of transparency into what goes on when that pill leaves the pharmaceutical company and ends up in your home is where a lot of the money's made. And so I think if we can bring or insist on complete and radical transparency in what's going on with our drug markets, it would help CMS tremendously because it would allow us to understand, for example, is there spread pricing going on where those pharmacies that are going out of business are paid a much lower number than people are charged for the medications that they're getting, and then paid for by the U.S. government or other sources. Those are a problem. It's also an issue, as you know, if the actual rebates that are given, which is part and parcel of the PBM system, an archaic but widely used approach, if those rebates are actually fully rebating the monies that's being saved by the negotiations done by the PBMs. And I don't think anyone in this room, and hopefully no one watching, would ever think of doing a transaction where they didn't have a little bit of insight into what everyone else in the party was involved in how much money they were going to make as a result of the negotiated result. And I believe, in order to protect the American people, and President Trump has been very clear on this, want to reduce the cost of medications to our government and to the American people, the copay. That's not happening right now, and we can do better. And the PBMs are one way of affecting that change.
Yeah, we certainly can. The rural health care and the provision of that is a challenge. It is a challenge all over the country, and there are occasionally folks in Washington, D.C. or in urban areas that don't think as much about rural America. Those of us that live in rural America and those families that we know firsthand know they also have heart attacks, they have babies, they have lives and struggles and emergency situations. They need access to health care. They also need someone to be able to talk to say, hey, I've got a question about drugs and about the interactions and what this looks like. That's their local independent pharmacist often on that. One of the areas the PBMs has been particularly bad on is this issue about tiering, where brand name drugs will come out, they'll give a rebate if the generic that's going to compete against them will go in the branded tier. That drives up the cost for American taxpayers. It drives up the cost for the federal government. It is a big issue on that. The latest studies that came out said more than half of the generic drugs are actually on the wrong tier. That's an issue that we need to be able to address legislatively, but it's also an issue that I think CMS can also engage with directly on that. So I look forward to that conversation in the days ahead of how we can actually do that. I want to bring up one other issue. We have a shortage of nurses around the country. President Biden's CMS put out a new rule saying to long-term care facilities, nursing homes, other facilities that they have to have 24-hour care for a RN that's in that location. Now, that sounds like a great idea unless you're in a town of 5,000 people, and there's just not another nurse that's available to be able to do that. So the real result of that is it's going to close rural nursing homes all over the country on this. This is an action that the Biden administration CMS took directly on this. This will be an issue that you'll have to be able to address soon on that. I would ask only that you come back and review that, because we'd like to keep rural nursing homes and long-term care facilities open and available for those families, not have them closing and just tell them in rural America, drive 200 miles with your family to get access to care.
Senator Lankford, thank you for raising that. It's an issue that I have spoken about with community groups quite a bit in preparation for this meeting. If confirmed, I pledge to come back to you with my thoughts. Senator Wyden brought up the exact same issue from the other perspective. So I appreciate the arguments that are being waged here. They're thoughtful ones that deserve more attention, and it'll be one of the earlier things I focus on.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Cass.